As Omicron continues to be a concern here in Arkansas and around the nation, doctors are learning more about this new variant. Dr. Amanda Novak joins us live from Baptist Health as we continue our COVID-19 talks this afternoon. Dr. Novak, thank you so much for joining us today and discussing this with us. Let's begin talking about the symptoms. We've seen some reports from doctors in South Africa saying that symptoms from Omicron are mild. Does this hold any truth, and what do we know about the symptoms?
Right, that's certainly what's been reported so far, and that is certainly better news than the opposite, than knowing that these people are severely ill. But it's really too early to say. I was looking back at old CDC alerts about when this first was discovered in Wuhan, China, and when they started reporting it and we started making a big deal about it, there were about 60 people infected, and at that point, not a single one of them had died, and not a single healthcare worker had been infected. And so that seemed reassuring at the time, and obviously that was too soon to say that. And I think that's really where we are right now, is that, yes, it is reassuring, and we really hope that this Omicron variant is not as severe as some other variants. But hospitalizations and deaths typically lag by several weeks. And so what we know now is if even a small percentage of these new positives that are coming up in South Africa need to be hospitalized, then it could be really devastating to the resources there.
Something we'll certainly keep our eye on. Let's talk about vaccines now. Vaccines available for kids ages 5 to 11. It's been about a month now, if not longer, that they've been available to that age group. How do the numbers look as far as that age group getting vaccinated?
Right, and I don't have the exact numbers. I know that we're not vaccinating quite at the rates that we would like, especially considering how many children have been hospitalized or sick with COVID in the state. Over 100,000 of the COVID cases in Arkansas are in pediatric patients. And so clearly this is an illness that has affected them. And what we do know from the last month of vaccinating 5 to 11-year-olds is that they have really tolerated it very well. The ones that have gotten it, very few side effects, very few symptoms, very few complaints at all except for a sore arm. None of those children have needed to be hospitalized because of side effects from the vaccine. And that's in contrast to the actual virus, which we know has hospitalized nearly 1,000 children this year. So some good news on the vaccine front, but we still are really encouraging people, especially going into this holiday season, to get those 5 to 11-year-olds protected.
And let's go back to Omicron for a moment. We keep talking about this new variant. Let's take a step back. Is Delta still the dominant variant right now?
So absolutely, nearly 100% of what we're seeing in our community is still Delta. But what we know from this Omicron variant is that it is taking over in South Africa very quickly. So every time a new variant comes along, it starts to replace the old variant, sometimes quickly, sometimes slowly. What we're seeing Omicron do in South Africa particularly is it is skyrocketing. It is going from 0% of the variants to well over 50% in just a few days. And so that would be the fastest transition to any variant. So while we still have Delta right now, it really could switch in a very short period of time.
Dr. Amanda Novak joining us live from Baptist Health. Dr. Novak, thank you so much. As always, we appreciate you.
Sure.